My talk today is about the projects we had between Ireland and Sudan. And as you can see from the slide, we have 3 projects. I'll talk about them very quickly, and then we'll go to the main important area in my talk, which is the benefit of these programs. Sorry for that. And what we learn and what is the lessons from these projects. As you can see, we had 3 programs. One is the maternity twinning program between Cork and Sudan, between the maternity hospital in Sudan. And the second one is the neonatal registration program. And the third one is neonatal, it's called Helping Baby Breathing. Before I go further, I just want to give you a quick view and information about the country, about Sudan. And Sudan was one of the biggest countries in Africa up to 2011. The total area is about 1 million square miles. From 2011, after the separation of the South, it took 1/3 of the total area, and the total area now became 700,000 square miles. Population is about 37 million, and more than 43% of this population, they're children less than 15, and no doubt, looking for the health profile in general, there is different difficulties in malnutrition, infectious disease, and maternity and neonatal mortality problems. No doubt, still there is a lot of poverty, a lot of difficult areas with war, especially in the south. Recently, they reached a peace agreement 3 months ago. Still, there is conflict and war in the west, and there is a lot of dislocated population. And no doubt there is a lot of migration from rural to urban areas because of the centralization of most of the services. Our first project was related to the maternity mortality, because we know that Sudan is one of the countries where the maternal mortality was very high, one of the highest mortalities in the world, more than 500 per 100,000. And because of that, we thought about this project. The project was a multidisciplinary partnership between the Cork University Hospital and the UCC, University College Cork, and between the maternity hospital in Sudan. The biggest one is called the Omdurman Hospital. This hospital, I think, is the biggest maternity hospital in Africa, and maybe in the world, really, because we couldn't find a matching hospital to it. It's about 36,000 deliveries per year. Nearly they had about 100 deliveries per day. So it's a very, very busy hospital, and it's attracting a big number of population. And because of that, there is a lot of difficulties and very high mortality. For our program, it started in 2005. As you can see from the slide, and maybe the things are small a little bit, there was 20 staff went to Sudan for 10 academic visits. We had different departments involved in the project, obstetrics and gynae, and pediatrics, neonates, IT, administration, HSC, ambulance group, fire brigade. So there is a lot of people involved in this program. And also we had a good Irish fund, and that was 120,000 matched by the Minister of Health for structural investment. When we come to the equipments, I think we've been very lucky, and this chance, I don't think it will come easily to other people, because at the time we are in the middle of the project, the 3 maternity hospitals in Cork, they closed. And the government decided to open a new hospital with new equipments and new facilities, and we got an agreement from the HSC to take the equipment. So we took all the equipments. I think we left the walls, we left the doors, we left the windows. So we took everything and we shipped it to Sudan. That was one of the biggest achievements, because all the equipments were very needed, and they're all nearly functional, and we were lucky to send 8 40-feet containers to Sudan. What is the results of this program is amazing, because we managed to bring the mortality, the maternal mortality, very quickly over a few years to a very significant figure. In 2003, before the program, it was 216. In 2007, nearly by 3 years, 4 years from the program started, we dropped the mortality 28. The drop was 86% drop in the mortality, in the maternal mortality. That was very significant drop, and the people noticed it very quickly in the hospital. Also, there was a 50% reduction in the stillbirths from 33 per 1,000 to 19 per 1,000. This is slide just to show you the same what I said before, including also the neonatal mortality, which is also improved, but it was not statistically significant. This is one of the academic sessions there, as you can see from the thing behind Professor Tony Ryan, and we had about 10 visits like this visit with different workshops and courses and instructor courses and different kind of activities. This is the equipments. We are trying to load it in Cork. This is in St. Finbar Hospital. This again, trying to build the equipments. I just want you to remember this person here. I'll show you him again. And then this is the equipment back in Sudan, after we receive it in Sudan. And then this is the award. We had the Irish Health Award in 2009 for the best program outside Ireland. And really, we think it's one of the biggest programs in the world. We achieved a lot of good results, and the project was very successful. We moved to the neonatal area, and as you can see also from the slide, the neonatal mortality is very high in Sudan. It's about 36 per 1,000, and the infant mortality is also very high, about 68 per 1,000. Because of that, we know that the most important reasons for high neonatal mortality is the birth asphyxia. Newborns, they have great difficulty when they're in the process of being born, and they have a lot of respiratory difficulties. And also there is other causes like prematurity and a small for days baby and sepsis and infections, but asphyxia is a major cause for death for babies there. This neonatal recession program is a hospital-based program. It was introduced in Cork or in Ireland in 1994. And the course covered all the country. And then in 2002, we started the first course in Sudan. As you can see, I put it as a second project, but to be honest with you, I think it was the first project because this project started in 2002. The maternity started in 2005. But when we started this course, we noticed the need for courses and work for neonates and also for maternal side. So we start providing and giving courses for providers and for instructors, and we link the course or the program with the UCC for certification and for updating and software and equipments. And the program is running till now, as you can see. There was 2 studies done for this program, one in Cork in 1994 and one in Sudan in 2004. 2 studies studied the effect of this structured program and the parameters pre and post the program. The 2 studies confirmed and showed that there is a lot of improvement in the skills and knowledge. There is a lot of improvement in preparation for equipments and for arranging the delivery rooms and the gestation areas for babies. And also there is important drop, or there is a good, significant improvement in the mortality and the morbidity. We had about 40 courses providers, and we taught about 2,600 providers. Also for the instructors, we had about 15 courses and about 340 instructors still today. So the course is continuing. This is just to show you the teaching for this course. And then we move to the third project. The third project is also related to newborn babies. And this course is the basic resuscitation program, targeted the birth attendants in the resource-limited countries. So this program really suits Sudan very nicely, and we started the program in January 2013. The main objective of this program is to reduce the mortality of the neonates, the neonatal mortality. And the program was also supported by the University College Cork, also supported by the American Academy of Pediatrics. On the other side, Ministry of Health, Sudanese Neonatal and Pediatric Association, and they're all supported the program and help us. And also we had an Irish fund for the initial phase for the training equipments. We try to improve the level and the standard of care for neonates, and we targeted the village midwives. Why the village midwives? Because they're covering 85% of the population and 85% of the deliveries. As you can see, 85% of the deliveries, they are occurring at home, and they're attended by village midwives. They're distributed over 18 states, and our target is to try to finish this number in 2022, hopefully. And no doubt we had difficulty now with the equipments because each midwife will cost about $20 because you need to give the midwife an ambu bag, which is equipment for breathing, and a suction device. It will cost about $18 to $20. And we're trying to get funds from SHARP, from Irish Aid, from Sudan locally, and we're trying to get these equipments for the numbers. Up to now, we had about 191 courses for providers, and we taught about 4,000 midwives, and we did about 14 instructor courses, and we had about 337 instructors. This is one of the courses there. And also, we had an Irish award in 2017 for one of the best programs outside Ireland for public and for healthcare. So we move to the main question: what is the lessons and what we learn from these programs and from these partnerships? I just want to remind you the WHO partnership guidelines, and they stress into 2 points. One of them is the mutual benefit. I mean, the co-development, co-learning between the two sides. This is the first aspect. The second important point is the right balance between the interest of the organization and the national interest with the people on the other side, with the low resources or favorite less resources institutions and countries. So if you have the right balance between these two sides, probably you are going to get a very good outcome. We think the main benefit, if you start with the country, will come back to Ireland, because Ireland will build a strong relationship across the globe. This will come in favor for the country, will come in favor for the organizations, will come in favor for the professionals, and will come with favor for the community. No doubt Ireland, I mean the health system in Ireland, will get benefit and learn for itself because of the diversity of patients and the diversity of people now living in Ireland. And I'm sure you know now the picture of the society is changing. There is a lot of people coming from different countries. No doubt there is innovative workforce. And when we say innovative, we mean that there is a new methods, new thinking, new ideas, and all this will help to improve the system. We're hoping that Ireland will lead the role in the global health in different areas, as you can see in the slide, for healthcare and health education and research, global health learning and international development. There is a lot of areas the country can go on, and it will bring a lot of benefit to Ireland. As you can see from this slide, it will reflect what will happen to the institution. This is just example from our one of our programs, where there is a lot of people got involved, administrators, midwives, doctors, engineers, IT, ambulance, and fire brigade is not here. These people, they work as a team with a multidisciplinary approach, and no doubt they brought a lot of benefit for themselves and for the organization or for the institution. This will bring a lot of changes for the way of thinking for the people involved in these programs, and they're trying to improve the service and try to come with new ideas. No doubt there is a self-confidence for answering different kind of questions for what to do with different areas related to the work. No doubt these people, they'll be able to look for the present and for the past, present, and future projects. They can plan right, they can evaluate right, and they can look for the best outcome. No doubt there is a personal benefits, and this will be demonstrated by the superoptimal qualities. The people involved will get a better managerial skills and can easily develop strategies and thinking for planning better. They can set directions for different kind of resources. They're interested in improving the service and the work, and they create new visions. No doubt there will be development in their leadership skills, and we talking about positive and supportive environment for the people involved. They encourage high expectations for people to come with new ideas and new visions. They try to build network with others to come with better outcome for patients. Teaching benefit is also clear that the people will get a lot of benefits from teaching, fulfillment and excitement and new ideas and learning from others, and recognize ways to improve the teaching. We'll come to the question of sustainability, and we think we easily put an example for similar global health projects in the future for ourselves and for the other people. We want to emphasize and talk about the importance of the Irish-based Sudanese doctor, because this kind of people, or these people, they bridge the distance between the two sides in different areas. And I won't talk in details, but they're very important to link between Ireland and Sudan. No doubt the real sustainability will be by establishing good protocols, improving the job descriptions, improving the environment, the work environment, and one of the important things is to keep the doctors at home, to keep them in their jobs. And these projects were established and approved by our organization. It's called the Sudanese Doctors Union in Ireland. I was the first president before 9 years, and today our new president here, Mr. Weil, he's a consultant neurologist, he's also here. We are planning to have a document for the past, for the present, and future projects to be like a draft for what we are planning, or what we did and what we're planning to do. And I think involving the people in Ireland will bring you a great success in the future. Where to go? I think I saw the ESTHER revision draft and assessment tools. They're really talking about what we're supposed to do in the future in relation to the program, which is finished, like the twinning program, that we need to follow and evaluate and see the progress and continue with the positive approach with them. We need to continue the neonatal registration because this program is continuing. And we need to continue with the helping baby breathe because this program is continuing. Protocols and updates, as I mentioned before, and we strengthen academic links. And I think my colleague, she spoke before me about establishing new academic links with the Minister of Health in Sudan, which is a great step. One of the things that you continue with it and establish is sustainability. And then scholarship is also part of the. So the main projects now continuing is the Helping Baby Breathe and the Neonatal Registration Program.